I found sometimes the therapy sessions can typically start with the weather or the snow or something of that, but just engaging with that. Um, and as a clinician, that's where I work hard to just be cognizant of what's going on, um, and how my mannerisms can shut people down. With I always wear a huge watch because I know if I was oh well, time's up, but I can see it on my peripheral when I do that, so it doesn't break the um, whatever the train of thought that is on. So that's where I want to be present to hear what they have to say. Um, I don't know if that answer your question or.
Oh, it did. Yeah. Thank you.
Ali, anything to add to that?
I mean, really nothing other than I think the watch is a great idea. Normally, I've had especially with telehealth sessions, I'll have the corner of my screen the time present, or if in an office setting, a clock on the wall. Because I know as clinicians, sometimes if somebody's given us a lot of information, to re-summarize that, to show that we're, actively listening, sometimes we may take a moment to pause and we may reflect on how much time we have left for working with that person. And, especially, and I'm just kind of laughing to myself, thinking of the training that I had undergone in my grad program, but also continued. I remember, you'd watch those videos where the clinician just starts eating popcorn during a session, and it's like the person's talking and they're like, what are you doing? Or they're, oh, hold on, I'm sorry, my phone's ringing, it's my son, I have to call, you have to pick him up from school, hold on. So you never want to break that presence that you've built, and it takes a lot to get there. And like Dr. Asher had said, the icebreakers are so important, because sometimes people come in, hey, they put their feet up, they want to talk about everything, and then other times they're like, I have nothing for you, you have to start it. So that's why, icebreakers, the weather, everything is just so helpful. Yeah, these storms we're having, or it's sunny today, do you have any plans? And again, it just opens that dialogue so much more, to discussion.
Makes sense. So,
It,
oh, go ahead.
no, go ahead.
I did want to circle way back again. Sorry, I keep bringing us back to things that were brought up forever ago. But we when we were talking about trauma and the impacts of it and everything and recognizing it, one of the things that I have recently learned, relatively recently, like within the last year or so, is that there's actually a lot of different I guess diagnoses for trauma. Like, I think everybody's aware of PTSD. There's a lot of, you focus on that or exposure to that. But I also learned recently of CPTSD or complex PTSD, and I heard a clinician joke that they call it childhood PTSD because it for a lot of people it stems from a childhood experience. And then Dr. Asher, you and I were talking not too long ago about ASD or acute stress disorder. What what is the difference between all of those? What do they mean? Because I mean, they're acronyms. That's what I know.
Um, in a they technically go back to the DSM, DSM-5 and DSM-TR, and a lot of times the diagnoses are based on time, as far as have they experienced within acute stress disorder. It could be the matter of hours or a few days, but like if it's more than I think it's 3 months, it can transcend more to PTSD. Um, Either one of them can be based on a functional thing, whether it be um, working in a very stressful or helping with a tragedy out in Texas right now. Um, so the the DSM is kind of like a cookbook. It has a different criteria that it can meet that, and sometimes they have different levels of severity, and also helps with the prognosis. It also helps give it a name, and sometimes it's very therapeutic in itself for somebody to give it a name of this event when my brother tragically died, while it could easily be depression, but it could be also the stress if they're left with whatever the situation is if their brother passed. Um, the other one I think I touched on briefly is the moral injury, and that's recently tied in as well because it could be something that you all of a sudden find yourself in a situation of the continued stress that we've talked about, and yet it's impacting your belief system or your moral that you didn't know it at the time. You're just doing what you're told, following orders. So that could be a combined diagnosis. So they all have different layers or flavors. Um, so that the criteria that I have found is usually the time or the age group. Um, Children will have, if you're before 12 and whatever, but that they do progress more if you've experienced that thing to adulthood or in a childhood. And the tricky part is if it's trauma, you may not be experiencing that trauma till adulthood or recognizing it, dealing with it. It doesn't lessen the degree of it, but it brings up the criteria and broadens it to other things that could have impacted it.
Hmm.
Was that vague enough? I mean, that's I mean, that's just been my experience, and because things that the TR, what I like about it is also identifies which one will take precedence over the other. If the adult or child is also experiencing this, this disorder will take precedence over. This will be like a secondary, impactful thing.
Mm-hmm.
I also, with that, I wanted to talk about uh, two and a half conversations. One conversation kind of led into the other. Conversations that I had about diagnosis and trauma, and the one was with a clinician not too long ago who basically said that the vast majority of the time that there's an issue, trauma is at the core. Some sort of trauma is at the core, which I thought was very interesting. I don't know if that was their opinion or like a widely accepted fact, but it was just something that I thought was very interesting, and that led into a conversation that I was having with a friend of mine who they have they've diagnosed neurodivergence, ADHD, and spectrum disorder, and I was talking to them about how they're having a lot of trouble getting past certain things in their life right now. Um, and I mentioned that conversation of the clinician basically saying that most of the time it stems from trauma, and that the treatment for trauma is different from treatment for something like ADHD, and they talked to their therapist and to their psychiatrist about it, and started walking down that road of exploring their trauma to to great success. So I guess my question is, you know, how do how do clinicians kind of drill in uh, on that treatment? How do they see the part of it that's trauma, and how do they work with the part that is just, hey, this is the person uh, being neuroatypical, if that makes any sense.
Um, it does, and often it can present the same way as I think ADHD could presents a little bit different in gender, boys and girls, as does depression. But yet sometimes that's the go-to diagnosis when it's could be things on the spectrum, and it's one of those complicated answers. As you get older, is how your defense mechanisms or how you coped with it, and you wouldn't even think of trauma, don't recognize that as trauma. That's just something I went through. We all drank through the water hose when we were little kids. I mean, it's what you think of now. You're taught that it's supposed to be trauma. Um, it's not to minimize that, but it's how you had adapted through the years that may um, blossom or protective into ADHD or things that are on the spectrum. We Asperger's is no longer part of the DSM, that diagnosis. But yet we used to use it all the time, and we disguise it as, "Oh, my filter's broken," as that way for coping. And I'm not sure if it's answering your question, but it's trying to sort out what is um, a question that is sometimes helpful for me is, are there any other times when you don't, what are some other times you don't experience this? Um, and again, I've worked with adults and children, but children will tell you, "Oh, never at home," or always at home, or just at school. And that's why a big part of diagnosing ADHD is to see them in different environments with their family or siblings or school, because what they're talking about is giving you a clue that it's something about that particular environment, their home, or whatever that provokes that energy, or that hyper changing subjects, or not changing subjects, but redirecting their attention themselves just to stay out of harm's way, where it may not get that at school, or vice versa. And that's a challenging part, but it does. The other side of that coin is there is some comfort, as I explain to the clients. Just I'd rather let's just explore and try to throw out the things that don't fit, such as home, or is it all the time, or do you find yourself there's a book out that will give you actually questions that drive towards how to help clarify if it's for simply for um, preservation of self, or is it to avoid the environment and help get out of it. That was pretty muddled. I hope you got something out of that. I don't know if that explained it. Maybe y'all can share your experiences.
Allie?
Well, and something about the DSM is, I've even had clients come in with a physical copy of the book, and they've sat down with me and they're like, "Okay, highlighted here, tabbed here. I've read this book from front to back, and I think I have 5 of these things," right? So to kind of yeah, well, to validate them that yes, they've taken it upon themselves of that research, we go together through the book. I mean, it's not something you see every day, but there are people who question, like, what's wrong with me? Is it something from when I was a kid, right? And I know that Dr. Asher had went into great detail in terms of, some things presenting themselves earlier on, sometimes, coming later. And again, a common theme of this, podcast is discussing that, sometimes it is difficult for someone to come for help, but it's very commendable when they feel comfortable doing so. With that being said, some things, especially within childhood, I think about oppositional defiant disorder. Should a child not have the means or have went for therapy, later in life, that can translate into rather more, I don't want to say complex disorders, but cause complexity with relationships with a spouse, friends, even self. So, as clinicians, we hope that the sooner that someone feels that they recognize certain traits of themselves, or a parent seeing different things in their child, you know, perhaps it would be a great thing to include a pediatrician and or therapy components on top of it to get to the root of what kind of is going on for continued management of it, right? Like, I think that's something else that people will come into therapy and share with us as clinicians of, well, I read that people suffer with anxiety for years. There's no cure, right? Like, is this just pointless? Is this hopeless? Well, again, as the professional, you're reminding them that there is ways to manage these things and make their life kind of in a dialectical behavioral therapy perspective, make life worth living. Find a way to make your life worth living, being present while we're here, even in this virtual room conversing right now. The relatable topics we're discussing goes hand in hand with what you would share in a therapy session as well.
Uh, if I can piggyback on that, I haven't had the DSM experience. I've had the WebMD, which which sometimes they'll lead up. Hey, what have you learned about this? And they'll pull out the copies they've made from WebMD. And some of that I've also attributed to, in our culture, we advertise medicine prescriptions on the TV all the time. And they would tell me, I need this drug because I saw this guy on TV and he took, because it's an advertisement for a medication. And I'm still depressed. So, well, um, it's helpful to know that information, where they got it from. But it is the self diagnosing that, and if I, whatever track that gets to, but again, to help um, uh, to take it as information and not necessarily guidance, as where it's headed.
That was my next question to you guys in regards to self-diagnosing. I feel like a lot of it's going around, and then I just wanted to get your thoughts and perspective on what the benefits are and or are the risks, or getting a professional exposure to a clinician. Like, how would that depend, and how might that help someone?
When I worked at the VA, we had to go through their medical charts for even their blood work and their test, which uh, now I'm very grateful for that, because particularly for veterans that were of an older age, the Beers list as far as medication that you need to take different or not, that affects you differently. And so it really helped to just even the medication they may be on, or may have decided to change the dosage because it works, those little things that are not take it all. Well, we didn't give him that anxiety medication because he's off for the summer. Just all those, then direct him back to, I do. I said, well, let's talk to the primary care about it, or the psychiatrist, whoever is dispensing that, because there's a lot of factors, as we know, that could be impacting that. And if I just had this, I'd be better. The just if syndrome, um, be it medication or to beat, I'll take more, I'll take less. Um, that's the primary experience I've had of people self-diagnosing, um, usually with wanting something that'll just take it away without having to do the hard work. Um,
Allie?
Yes, so in addition to what Dr. Asher had said, as far as someone that could present with self-diagnosing, I've had hand in hand people that have come not just self-diagnosing, but physically self-medicating, right? I know we went into a little bit of detail in regard to, people, hey, I saw on an advertisement that 99.9% of people are happier um, on this specific medication. So, I want to be on that because it just seems like the research shows that I'm better on that. Now, I have had individuals who have come to me now with my specific license. I'm unable to um, prescribe any sorts of medications. However, I can involve, a psychiatrist, and or I know some states have different regulations for this, but involving a primary care. So I've had people come in saying, I'm on three different medications, or I'm taking I think one common one that people have researched that have come to me have said Tylenol helps them with anxiety. Now, some research says it does, but again, we don't want to be taking excessive amounts of Tylenol due to the health factors. I always let clients know I'm not a medical professional. However, if there are instances where I'm learning that you're, consuming many different oral substances and or other things, I mean, certainly these aren't crimes. We don't commit, or report crimes, right? But it is important to focus in, like Dr. Asher was stating, monitoring even one's blood work. Now, as a clinician, we can't do that,
Right.
in certain instances, but it's very important, especially when there is a medication or substance component involved. We want to be very fragile and careful for someone's not just mental well-being, but physical as well. So that's why I think it's very important to have the documentation in place as a clinician. Some clients come in, well, you know what, fine, talk to my primary doctor about the meds I'm on. You guys can work it out. You get a release of information. You can all kind of collaborate together that, hey, I'm working, and you can only disclose so much as a clinician. They can only disclose so much. But going hand in hand and working together, even as a clinician with a psychiatrist, it just allows more of the ability to help the person further. But yes, some people have come in saying, I will smoke marijuana whenever I'm upset, but then when that wears off, I need more. Um, Unfortunately, again, sometimes people result to those components just based off of others' experiences. But again, it could lead them to more feelings of hopelessness and further, sadness.
And if I can pick on that, it's also help them. I've had some parents that are very involved and present with their child, or doctor put them on this, and they've noticed the child's been losing weight a lot, and to give weekly updates. And so I can help her work into how to bring that up to the doctor, because you're the mom. You see that, rather than having me be the channel. If you want me to write down something and give it to you as far as what to say or the main points you want to bring up, and because it's all new to them as well, particularly if they're the caretaker. Or I see with the elderly, as far as even um, painkillers, opioids, and the the veterans in palliative care. Um, so my role in that is just to talk about quality of life and the family versus things that they can bring up with their doctor if they're in the last 2 weeks of their life.
So,
So it's
oh, go ahead.
no, I'm done.
On that, I did want to evangelize, so get up on my soapbox a little bit um, about how one of the things that I personally get frustrated with around the healthcare industry and the mental health care industry, um, because there is a fair amount of distinction between the two. And if you don't believe me, talk to an insurance company. um, but the is that to me, it's a holistic approach. Like there's a medical part of it. Certainly, one of our podcasts, we talked about the correlation between mental and physical health. But there's also a like there's a mental health part of it. And what I've seen, and in some places, in a lot of places, codified into law, it is that, hey, we should keep those realms separate. And to me, and if anybody has any insight on this, or if it's just a I don't know, that's fine. I just kind of want to, like I said, get up on my soapbox. But to me, that doesn't really work. Like there has to be some level of exchange. Like I don't necessarily want my doctor conducting my therapy, or my therapist, reading my X-rays, but there is a very strong correlation between the two. And it seems like there's just this hard and fast wall of like, no, we can't do this. Are you able to speak to why or how or what that's about?
Um, and trying to. I think many times it is separate, just a matter of um, specialty of experience, and I- I've experienced in the hospital too, because you're not a real doctor, um, but it also gets to, now what I've seen when they've got the interdisciplinary teams, and I've been on some that are just fantastic. There's actually dialogue, and I always have to bring the nurses in, because if there's anyone that knows the veteran at night, it's those nurses, or can share the information, so I can see the boundaries and the walls tearing down um, a tad. But you're right, there is still a lot of this is um, silos of no cylinders of excellence. I think they call them now instead of silos, of uh, not being in their area, and nor should we. I mean, it's not our area of expertise. But we could have a client that says, "Yeah, I take these and I would get them off the internet." Um, to me, that's a flag. But besides talking about with the client, that definitely should be shared. Or taking their roommate's medicine, and it's a way to keep them separate but different, but the same, in the sense of the client's care, the whole picture, and particularly if they've just had a major a surgery, dental work. It could be anything that's impacted them in a way, to even include the anesthesia. That that can impact you. Have you talked to your doctor or your anesthesiologist about that? But to realize that it's not necessarily the jumping off point that it could be, but it also could be. Um, does that sound like double talk? But that's
No.
where the whole communication, just along with the care providers. And I've had some doctors that I've worked with that would write the letters back to the insurance companies in lingo that he goes, "Oh, I know what they're looking for," as far as the language that you use, instead of just trying to serve certain pill or something of that nature.
Yeah. Ali, did you want to add to that? Because I mean, I know that Lamco Wellness is trying to, in some ways, to bring down those walls and what that can look like.
Yes. So, and actually, it just came off the top of my head as far as what Dr. Asher had stated of, you know, with sometimes somebody having dental work, with having a injury, major surgery, there could become that level of codependency on a substance, which I think I could probably go into a whole other podcast on that topic. However, for the conversation that we're having, yes, Lamco Wellness, we do have a medication management program, and some people may contact us to elect into that. But I think, I mean, and this just goes from my years of working in clinical, I think medication management and therapy can go very well hand in hand. And if someone reaches out that's unsure, like, well, I don't know. I know you guys offer medication management and therapy. So what do you think? Well, I always let people know that it's up to them. And maybe it's helpful for them to start with therapy because that's something that they can discuss further with their therapist. I know talking about medication, yes, for some, they know they want it. They know that that's something that they're looking to enroll in. But perhaps for others, it's very scary. Like, oh, I knew someone with maybe a more poor experience on like that medication, or I've heard horror stories. So working through and processing those thoughts and feelings with their clinician that they're working with on a regular basis to unpack, maybe that is again um, up to the level of expertise of that clinician to say, hey, maybe it is time for medication management, or hey, let's cross down that road and talk about it. What are your reservations of it? Again, it's up to the person of the care they're looking for, but we do offer both.
And we can bring that back to all the way back, like to veterans or first responders or other people that you hurt or you injured, because to admit that they're in pain, and to mention pain management is well, that means I'm not tough enough. I mean, the translation that goes on is, again, it's their answer, their choice, but to also know when to address what um, could be preventing them from recovery, whether it be um, the reasons, as Ali was saying, just for reservations for it, or for some, what was that? So,
I heard it too. I don't know.
any of that's to get the more information, but also realize that, and pain, if it's for pain, everybody experiences that different. Yeah.
Makes sense. I did want to kind of bring up, because we touched on it a little bit, but it's something that I find really fascinating. It is this idea of compartmentalizing, because I think we all do it to some extent, and it's a and if I'm wrong, please correct me. Um, it is in large part a survival mechanism because we're all to varying degrees dealing with potentially traumatic or difficult situations every day. And so compartmentalizing to to some extent, I think, and if I'm wrong, please correct me, uh, is sort of an internal coping mechanism. But there's also that part of me that that when I think about it is always like, hey, that's the thing that serial killers are known for doing. What what is where is that line, like, because I tend toward helpful, but there's also the kind of this dark part of it that gets associated with it over here, um, and I don't know how to personally how to reconcile
Um, Since they call Crime Stoppers, and no, but serial killers. Compartmentalizing too is because we know it does. It's very useful at times for depending on the situation and what you're doing. I would want my surgeon to be compartmentalized. Um, I- at the other side, there's um, I think recognizing part of our knowing ourselves for when I get into extreme focus, if it's on a whatever, I have to recognize that or and tell someone, okay, I got to get back because if they give me a grocery list or anything, I'm not focused there, and I know I had to compartmentalize. I have to get to this later. As much as I think sometimes brought up to do everything that you can, and um, we can do it all. So we've learned to compartmentalize many things, and eventually, so my experiences by the compartment, there's some of them have a time limit or the individual things. Oh, that happened a long time ago. It doesn't matter anymore. Oh, well, oh yeah, that happened. I was mad, but I'm over it. And yet the same theme may be reoccurring. Um, so that's where I think one of it is just for me, what just recognizing it about yourself. Um, it, some people may go to the extreme of saying, "Well, now I have OCD," um, but no, it's from that point of extreme of being obsessed to perseverating on something. Um, and it, just know when to are you choosing to ignore or compartmentalizing because of another something else you're doing that needs your full attention, and just trying to drill down a little bit more with the individual, and how they respond to that or not or justify it. Again, I think it can be very helpful, and it can also be detrimental if we take it too far. Uh, any other thoughts, Robbie, Ali?
that.
I know you're not a serial killer yet.
Yeah, I like that you added.
There's
Well,
always time.
well, to piggyback off of that point, yes, knowing yourself is important. Sometimes, and I think of a lot of analogies, right? Or I think of just common thoughts. If someone is feeling burnt out or tired or they're going through a lot, right? They can't be the best helper that they want to be to someone, right? Am I an asset or am I a liability right now to helping other people if I'm exhausted, if I am just trying to figure my own things out, right? So yes, recognizing yourself and almost even like comparing it to like a car, right? Like, okay, to drive a car, we need gasoline, the brakes need to work, everything kind of has to be in unison. Without all those things, it's not safe, right? It's not safe to drive ourselves and then have someone else hop in the passenger seat with us and be along for that ride and get to the destination safely. So in terms of trying to, bless you, thinking of how we can recognize those parts of ourself, it's just a lot of self-realization and self-reflection.
Trying to find that balance.
Yes, very.
I feel like that's what the answer always comes back to is internal reflection and introspection. Is that the word I'm looking for? I'll go with it. Um, but I do think that that's and to kind of bring up maybe go a little bit off topic, but that is in my understanding, a huge part of what therapy is. It's not, and again, this is just in my experience, like a therapist isn't necessarily uh, fixing you, as it were. They're really there to help you get the tools that you need to fix yourself, and then have the discipline, wherewithal, understanding to be able to pick those tools up and use them. And I mean, again, I don't know if that's just my own interpretation of it, but it seems like that's what's really going on when I'm in therapy. Like they're not really like, oh, here's the problem, here's the solution. They're really like, what will get you to actually make this better for yourself?
Um, there's a portion of the big book, Alcoholics Anonymous, that says self knowledge avails us nothing. And we probably have had people where go, "Oh yeah, I'm that way. I'm just really narcissistic." They may say it jokingly, but the self knowledge doesn't unless you pick up the tools and want to uh, the quality of life, the better life. It's you may be able to identify everything in the DSM, thinking that you have it, but as far as the self not, it's a self action to some portion of it. It could be a mental action or physical. Um, because yeah, I've just seen that as well, as far as thinking that, oh, I've got this, oh, it's just the way I am. And when I would teach things on temperament classes, as I said, it's not an excuse for behavior all the time. um, Particularly for the children with emotional problems, as far as trying to try different behaviors instead of what they're doing. um, it could be, as part of your personality, doesn't mean we have to act that, on that certain behavior. So that's where the self knowledge doesn't excuse uh, non-conforming, socially appropriate behavior
Yeah, yeah,
before you get to the serial killer part now. But it doesn't. At the younger age, and hopefully at the older age, the more social instincts you'll have.
that yeah, that makes sense. That reminds me. I also want to give Ali an opportunity to chime in, but it reminds me. There's this comedian that I find. She's on Netflix, Taylor Tomlinson, that I'm a big fan of. But she has, I guess it's a bit. It's really not funny unless she's saying it, but where she talks about how she was diagnosed with bipolarism, and now that she's been diagnosed, she's getting help, she's going to therapy, she's taking medication, and then she contrasted that with Kanye West, who has also been diagnosed with bipolarism and is very open about, no, I'm completely off the medication and I'm doing whatever I want. And she talked about how like it's okay to have a problem and to need to work on it, but if you have a problem, you have a problem, and you're not doing anything about it, then you become the a-hole. Is almost exactly what she said, but she didn't censor herself. But that,
Well,
like what you were talking about, kind of made me think of that, if that makes any sense. Sorry, Ali, please go ahead.
Right, and I think too, like, and I mentioned it earlier, like people will come into a therapy session or, contact someone and say, like, I just think I'm beyond repair, like I recognize I was the problem a long time ago, but then it's like, wait a second, let's step back, let's go back, to where that person's level of comfort is and see, like, when did you notice these feelings? What was going on around you, by exploring what at this time is the presenting problem, but looking a little bit further in the past, like we kind of dissect the situation in a essence, but then also put the puzzle together to learn, okay, like this is somewhat of the vision the person's having, in terms of what their life looks like, what their situation is, what the relationship is with themselves and or others. So that's a way that we also can help to diagnose what the person's going through, but letting them know that they're not the problem. but there are helpful solutions to manage whatever they may feel is the problem.
I thank you. I just want to say that's one of the reasons I love always having you on this podcast is I feel like I'm out here lightly insinuating that people are a-holes, and you immediately bring it back to, hey, people are people and they're struggling. Like there's just so much compassion and care that radiates from when you talk, and I genuinely I appreciate the counterbalance to me just kind of being all over the place and like whatever. So thank you.
Um, Again, I'll piggyback a lot, but um, I see that a lot with parents if their child has a diagnosis of being on the spectrum or something like that it's almost like they carry it in shame. My
Mm,
kid has, the whole body changes like that, and um, not realizing how that also impacts hope to the little ones, or have them feel um, more accepted, or that they're not broken, that they're not some. Um, uh, they already know. Kids already know that all kids are different. They got that, but as far as helping them achieve the point of where they're not anything to be ashamed of, and that they can be, they're just qualities for some. I had a little kid, I heard him say, "My brain just thinks differently." Well, that's beautiful. Who could say it better than an 8-year old? Um, but just how that I think carries over in ways that we may not even manage it, to either excuse behavior or to um, what are they wanting? And as Ali said, you just gotta love them where they're at.
yeah, yeah,
Oh,
that's a really good point. Um, we're running close on time, and I did want to touch on uh, one key question I have, just as a voracious consumer of media, and understanding that it's not often correct. Are there any like are there any like assumptions that people have about working in the military or with veterans or in the FBI that are just wrong that you want to dispel uh, now?
we're not all agents and we're not all pilots. As far as with the Air Force, because it's always, and then they don't want to talk to you after that. Well, did you fly a plane? And actually, no, I hired those people, but oh, you didn't? Okay. So it's can be very discrediting, to make that assumption, and that's why the people in support, then the bureau itself, over 2/3 are the support people, meaning the people that get the warrants, that help you gather the evidence, that do the intel work on the computer, that keep the other local. I mean, it's just so much uh, to engage, and everything is a cross and cross check, meaning because of the nature of what we do, you have somebody else verify. So it's not one person is more glamorized on TV, perhaps. Um, and again, those cases could go from person to person as they carry on, and they know, they being agents or pilots, um, that they wouldn't be able to function if it weren't for the other people around them. And that's just not to sound trite, but the plane won't get off. We we had C-130s, airlift for humanitarian. It wouldn't get off unless you had air in the tires and fuel in the wings, and um, for the trainings, making sure the pilots were trained and the fuelers were trained. I mean, so they realize the importance of how everyone, their role can be critical, and that's where I think the media is portrays it in a way. Many FBI, law enforcement, military never unholster their gun. I mean, you're taught how to train and how to shoot with it, um, but they just have never unholstered it, because a lot of the work that they do is with the engagement with the people and trying to put the pieces together, not necessarily an armed conflict. And uh, so it's just that's not really reality. And the point that I guess I want to, that's my own personal thing, is to put stomp, is they're there is an oath that we all take for the greater good. The Constitution, I mean, it's all for the greater purpose. It's not about um, to take anybody's rights or privacy away, unless there's a greater violation. And I'm not hope I'm not grandstanding. It's just that's I think the misnomer that gets out there, that they're evil, or even in our field now, I've had people say, "What, you trying to analyze me?" Of course, I say, "What, you crazy?" And then they think about that as they walk down the wall. "Oh, what do you mean by that?" But I say all that because we tend to go off the misperceptions, and media is probably the largest one, whether it's from 40 years ago um, to not. And so, as a clinician, um, we just ask. They'll tell you what they can tell you.
Yeah, and then I also wanted to put out there, what are the what are some barriers that we can, as people, and obviously both of you as clinicians, overcome toward getting people to seek help, and then along with that, where can people in high stress situations, like being, in the military, or in the FBI, or any number of dozens and dozens of other fields, where can they go for help, knowing that there is a stigma to it? There is the possibility that they, you know, maybe they lose their clearance, maybe they lose a promotion. As much as we try to, on this show, and in our daily lives, try to destigmatize mental health, and seeking mental health help, there is still the reality that for some people, uh, there is a risk that comes with it. It may not be a huge one. Maybe it is a huge one. I don't know. I can't speak to each individual. What do what can we do as people, however we are, to just, as you said, the duty to the greater good, to improve the world?
Um, Open-ended questions, I guess I would say. It may sound flippant, but what would it be like if who do you talk? Those kind of questions to expand more. But the questions of, have you ever um, you need to see anybody? Have you thought about seeing somebody? Can it be hit them to where automatically, no, I'm not, I'm not hurt um, or wounded. But it's getting past the objections of um, what I found is, and respecting that they can't tell, whether it be for family, for job. Um, there are places and organizations, but also I like to advocate for the having a person non-associated with the organization as well. They have contractors for psychologists all outside for federal agencies, and that way they don't know your boss, they don't know the people you work with, but they um, understand what perhaps your organization is going through. And um, recent times have probably been a great example of that. The stress, and they don't know what to do and don't know who to turn to, or if their job's going to be if they're going to be fired the next day. Um, but again, those stressing are just um, my train of thoughts rambling as far as where can they go, and who do they go to now, be it friends or coworkers, and then trying to encourage them to seek it. Um, and sometimes it's the families, as we said, no, at first, and they're worried about their spouse, um, how to get them to help. Uh, Allie, you want to take that one?
Yeah, no, as I'm having a coughing fit, sorry, I guess I need water, hydrate more. But to add to that though, sharing content, resources, all the above, of, help, resources.
And that's we could do a better job of that in Milwaukee. Wisconsin as far as sharing, um, because it'd be so much um, greater resource at the end. But yet, many times when the organization got started, you don't want to talk to the other organization. So just sharing, and also with the other clients and clinicians and their specialties. And if one doesn't fit, um, tell them to keep looking. There are a lot of places around, um, and there are organizations that will work on sliding scale or understand the need for cash only or pro bono work. Um, that I it's difficult for me to accept that there are people that need help that can't afford it, um, and get what they need. So the resources are there, and just um, help them find that door is about probably my answer right now. And that can also be for people that are we because of their job or their role in the job right now, they don't want to be, or they cannot, for their safety, be associated with the agency.
Well, thank you so much. I don't think we can top that closer, so I'll close it out there. And thank you so much for joining us. I would love to have you on again because this was a great great conversation. Um, Thank you to Limco Wellness for sponsoring us. Please leave a comment in the comment section, like and subscribe, and we'll see you next time. Thanks,
Okay,
everybody.
thank you.